Welcome back. Thom Hartmann here with you. Heather Higgins on the line. She is the new chair. It says chairman of the Independent Women's Forum. Is that the title you use?
Chairman, yes. I don't believe in politicized language.
Oh, okay.
Chairman is fine.
All right. But you're a woman.
I'm a woman.
Okay.
Yes. Last check.
IWF.org is the website, and Heather, you guys are running a new ad. Let me play the ad for our listeners so they know what we're talking about. We can put this all in context. Here it is, the new ad from the Independent. Of course, it's a television ad, and there's a woman on the ad and all that kind of thing, but I think you get the sense from hearing it.
Like 2.5 million American women, I survived breast cancer. My mother died of cancer, but today I'm a survivor, and I'm worried about what Washington might do now. Almost everyone agrees we should reform health care, but many want to create a government-run health insurance plan paid for by taxpayers at huge cost. Independent experts say tens of millions of Americans could lose their current health insurance and wind up on this public plan. England already has government-run health care, and their breast cancer survival rate is much lower. If you find a lump, you could wait months for treatment, and potentially life-saving drugs could be restricted. Government control of health care here could have meant that 300,000 American women with breast cancer might have died. My odds of surviving cancer were high because my care was the best. What are your odds if the government takes over your health care?
Go to Independent Women's Forum to share your story and stay informed about your health care rights.
Beautiful ad, Heather.
Thank you.
Very
She's a
well
lovely
done.
lady.
I
She's
beg your
a
pardon?
lovely lady. I said she's a lovely lady.
Yeah, and she's very photogenic. A couple problems with it. Number one, the group that you're citing, the Lewin group, is the independent group that you were citing the statistics from, some of the statistics, in other words, how many people are going to lose their health insurance, is the Lewin Group, which is a wholly owned subsidiary of the United Healthcare Company, the largest healthcare insurance company in America, that has paid their CEO over the last 5 years $700 million in compensation. These people are blood-sucking leeches on the back of America, and there's nothing independent about the Lewin Group. Secondly,
I don't understand why the Democrats use and rely on them, but those are the numbers that the Democrats have been used. That's the firm they've used, and those are the numbers that they use, and those are generally accepted to be real and credible numbers.
No, they're not.
Whoever has paid for it.
They are absolutely
yes,
not. And if any Democrat is using Lewin Group numbers, I'm unaware of it, and they would be crazy to do so because, as I said, the Lewin Group is a wholly owned subsidiary of United Healthcare, which has the worst ratings of all health insurance companies in the United States by their customers, and whose CEO is walking away with $700 million for 5 years' work, and they're paying out $5 billion in dividends. They are stealing our money. Secondly,
I'm not here to defend any insurance company.
Okay, well, let's take the larger issue.
issue.
Secondly, you're suggesting that we're going to adopt the British system. Nobody is suggesting that. Third, you're suggesting that Great Britain has worse breast cancer outcomes than the United States does. That actually, according to the Concord study, which I spent hours reading, I don't know if you've actually read that study or not. According to the Concord study, which was published in The Lancet a couple of years ago, which was done based on 1999 through 2004 diagnoses and then a 10-year follow-up, is actually accurate. The United Kingdom has among the worst numbers. But when they were looking...
In fact, all of Europe has worse numbers on almost every cancer, particularly solid tumor cancers, than the United States.
Right.
In large measure because their systems don't choose to pay for the early discovery that ours do. And secondly, because when any kind of cancer treatment, as I understand it, and I'm not a doctor, where you have the patient choosing to do something other than then take the pill or follow the established protocol, you get very different outcomes.
Well, in fact, if you read the Concord study, they point out in the study that they only looked at 14 states and 5 municipalities in the United States, and that when they looked at particular subgroups, for example, African American men and women in the United States, the results were far worse than anything you saw anywhere in Europe under any circumstances. And they had some very severe concerns about the methodology that they were using to analyze the United States. We were simply too big for them to analyze. Also with the UK, they lumped 5 different parts of the UK, Scotland, Wales, Northern Ireland, England, and whatever is the fifth, together, and there's wide disparity in income. And third, in the United States, for 15, 20 years, we've had a very aggressive, citizen-led, and God bless them, Examine Yourself for Breast Cancer program that doesn't exist in the UK, because just the idea of a woman touching her own breast is something that is not discussed in public in the UK, a remnant of Queen Victoria. So
this is the same country that has pictures of naked women to sell Murdoch's papers. I don't think they're quite as prudish as you would like to
Murdoch is the big exception.
It's because Americans believe that they ought to be responsible for their own health care, and they don't just defer to a national health service. They would not put up with waiting weeks and weeks and weeks to see a doctor to have even the initial diagnosis, and then have this tremendous shortage of specialists and beds that they have in these other countries.
These are not the reports that we're hearing from people in the UK.
That is not correct. I realize that Paul Krugman wants to dismiss every story that comes out of the UK.
And so does anybody who lives in the UK. We get callers from the UK all the time saying, "Come on, quit picking on our system." But your goal here.
This is a country that denied people care for macular degeneration until they were already blind.
We live in a country that denies people care and kills 18,000 of them a year. Are you not horrified by that?
No, to talk about fictitious statistics, that really tops it.
All right. Well, people can read all about it over at the Independent Women's Forum, IWF.org. Heather Higgins. Thank you, Heather, for dropping by.
We want women to have their own choices.
You're listening to